All right, it's been nearly 7 months since Idahoans first gained access to the COVID-19 vaccine. And as of today, slightly more than half of nursing home workers in Idaho have been fully vaccinated. Compare that to the nearly 80% of the residents in those nursing homes who are fully vaccinated. The Center for Medicare and Medicaid say we're not where we need to be. And just a few weeks ago, the Department of Health and Human Services, they started requiring nursing homes to submit vaccination reports for both residents and staff. So why are about half of Idaho's nursing home workers choosing not to get the vaccine? Here's Katya Stepovic.
I think we all wish the progress could be more rapid, but it is moving.
As of June 30th, about 53% of nursing home care workers in Idaho have been fully vaccinated. Cascadia Healthcare says several of their nursing home facilities' staff vaccination rates exceed the state's rate, but they fall short on a goal set by the American Healthcare Association to have 75% of nursing home care workers vaccinated by today.
So we're doing very well with the residents. Staff has been tougher. We have 7 of our 18 facilities in Idaho that are past the 75% mark. But we actually have one facility that is still down in the teens.
Zendi Mihari is a registered nurse and director of clinical operations at Cascadia Healthcare.
I think they have real fears. And I think one of the things that we hear in our nursing homes is that, the FDA hasn't approved it. So there's nothing that sort of gives them that little level of confidence. As with the general population, we have a handful of anti-vaxxers. They just haven't believed in it for their children. And some of them are, many of our healthcare workers are still young. And so they still live in the home with mom and dad and, getting through college and paying the bills and all that kind of thing. And so it does impact what happens. And Idaho's just not on the top of the list to be on that bold front.
Because of that, Mihari and Steve Lafort, the director of corporate affairs for Cascadia Healthcare, believe education and providing incentives for staff to get vaccinated is needed.
We have everything set up. So availability and, any of those kinds of obstacles that are put into place, we just don't have.
Talk to people, educating people, and being role models, and being out there getting the vaccine and, just continuing to be normal and having the facilities open up and see what the benefits could be.
But the reality that they are both coming to grips with is that a handful of staff just won't take that shot until FDA approval.
I do think when FDA approval comes out, it's even though that shouldn't be a flip of the switch, I think that will change a lot of people's attitudes. It's like, okay, now that excuse goes away. Okay, it must be normal.
The vaccine has been fine for all of us that have had it. And so I think some just being able to see that we've increased our numbers a little bit. I think it's really going to take a little bit for that last push for folks looking for FDA approval.
Okay, Katya, so if we believe the science and those with the vaccine are pretty well protected from even those that aren't vaccinated, there's still got to be some protocols in place for the people that are working around some of these senior care facilities.
Yeah, absolutely, Brian. And whether you are vaccinated or not, it's actually required for all workers to wear a mask at Cascadia facilities. Now, workers can only take it off when they're in a break room with others who are also vaccinated. And also, they just started allowing visitors at the facilities, and the same thing applies to them. Masks are a requirement, at least for now.
Yeah, well, it'd be interesting to see. I don't know. I might agree with him. It may not just be a flip of a switch when it gets that FDA approval to see how many then all of a sudden go get the vaccine. Thank you very much, Katya.